Hi, this is Carissa Newton, and I am presenting Intermittent Auscultation Nurse Education. Here is the overview of the presentation. Some background information. Intermittent auscultation involves the counting of fetal heart rate at specific intervals related to uterine contractions and can reliably detect the rate, rhythm, accelerations, and decelerations in the fetal heart rate. Use of continuous external fetal monitoring has not improved birth outcomes in low-risk women. Therefore, facilities need protocols and staff education for intermittent auscultation. Women's preferences and clinical scenario should guide fetal heart rate assessment techniques, starting with the least invasive and most likely to promote physiologic labor and birth. The knowledge gap involving intermittent auscultation involves nursing habit and convenience with EFM. Patients are not routinely screened for the use of IA on admission. Bias towards EFM and against IA, which could be related to inexperience or lack of exposure. Resistance to evidence-based care, and a sense of security with EFM. The clinical learning need involves improving vaginal birth rates. IA promotes physiologic birth. Moms are able to move freely and change positions frequently. EFM increases cesarean and operative births in low-risk women. One-on-one nursing care is involved with IA in that providing continuous labor support improves birth outcomes and reduces the risk of cesarean section. Also, clinical learning need is improving the birth experience, improving patient satisfaction with using IA with increasing the quantity and quality of caregiver support and shared decision making with an informed choice with the patient. The learners are labor and delivery registered nurses. Years of experience range from 1 to 25 years. Age range from 20s to 50s. Greater than 90% are Caucasian and female. Education levels include ADN and BSN with less than 50% BSN. And skill level and EFM and interpretation, just not as comfortable with IA. The goal of this lesson is to increase the knowledge and skill level of the labor and delivery RN on performing intermittent fetal auscultation and its importance in supporting physiologic childbirth. The first objective: by the end of the training session, learners will be able to identify appropriate patients for intermittent auscultation with no less than 80% accuracy on the post-test. Objective 2: by the end of the training session, learners will be able to identify the importance of IA by listing at least 3 benefits of IA on the post-test. Objective 3: by the end of the training session, learners will be able to perform correct technique and procedure of IA by a mock patient and RN simulation scenario with no less than 80% accuracy on a clinical performance checklist, followed by a debriefing and self-reflection. The method of instruction: lecture with a PowerPoint is good with introducing new material. It's straightforward, covers material quickly. A simulation scenario is good with application of knowledge, improving learner self-confidence, and it's in a safe and controlled environment. And then evaluation with a post-test, debriefing, and self-reflection. On to the literature review on simulation. This first study by Vermeulen et al. Is the experiences of last year student midwives with high-fidelity perinatal simulation training, a qualitative descriptive study. The purpose of this study was to investigate the learner experiences with a high-fidelity perinatal simulation among last year's student midwives. This was a qualitative descriptive study with 3 focus group interviews. The general finding was that the high-fidelity simulation was a positive and valuable experience for the midwives. The learners reported that they were able to apply their knowledge in a safe environment and they gained confidence in their skills. The debriefing experiences also provided valuable learning as they identified their own strengths and weaknesses. The study's evidence level is a 4. The next study by Baptista et al. Called Satisfaction and Gains Perceived by Nursing Students with Medium and High Fidelity Simulation, a randomized control trial, analyzed satisfaction and gains of nursing students after participating with a medium or high fidelity simulation scenario using a randomized control trial. This study reported that high fidelity simulation can increase learner motivation and knowledge transfer and showed increased learner satisfaction and decision-making skills with the high fidelity simulation. This study's evidence level is a 2. The next study by Karkowski et al., Breaking Bad News in Obstetrics, a randomized trial of simulation followed by debriefing or lecture. This study compared simulation debriefing scenario to lecture and teaching obstetric skills, specifically communication skills, to the house staff of a medical center. This was a randomized control study where the participants participated in simulation followed by either a debriefing session or a lecture. The participants then completed a second simulation scenario and the results were compared. Results of the study showed the simulation followed by debriefing session showed a greater improvement in the second simulation scenario opposed to a lecture. This study was at evidence level 2. This last study by Heglin et al., Simulation-Based Training for Nurses, Systematic Review and Meta-Analysis, searched for randomized control trials that evaluated the effect of simulation training among nurses. This study showed simulation as an effective strategy to improve nursing skills compared to other learning strategies, and that simulation can be used for quality improvement in healthcare. The level of evidence was a 1 for the study. In summary, the literature review showed that simulation-based training improves skills and communication, improves confidence and competence, improves decision-making abilities, quality improvement, and that debriefing further adds to the effectiveness of simulation scenarios. The rationale for choosing this learning method is that simulation provides a safe environment for the labor and delivery nurse to practice the technique of IA and become more confident. The nurse can see how using IA can benefit the patient by encouraging free movement in the progression of labor. Kolb's experiential learning theory is focused on active learning based on experiences. There are 4 stages in this learning theory: concrete experience or do, reflection or observe, abstract concept or think, and active experimentation or plan. Simulation ties into this learning theory and can be an example of a concrete experience or do for the student, followed by the reflection and debriefing for the observe and thinking, and then the active experimentation or planning for changes or additions to the next experience clinical. Clinical simulation is increasingly used in healthcare education programs for training, education, research, and evaluation. Simulation encourages the learner to be active and involved in learning and meets the demand of the technologically experienced learner. Simulation is appropriate for this nurse education as it will provide a safe environment for the nurse to practice the techniques of IA and will allow the opportunity to become comfortable with using and interpreting IA during labor. For the outline of the teaching content, for the first objective, identify appropriate patients for IA, we'll use a short PowerPoint lesson that covers who's appropriate for IA, so maternal contraindications, fetal contraindications, and interpartum contraindications. This will be evaluated by using a post test, and the resources for this information comes from birthtools.org, the toolkit for assessment of fetal well-being. The second objective, identify importance and benefits of IA, will also be covered in the PowerPoint, and the content will be the benefits for birth outcomes, patient satisfaction in promoting physiologic birth. This will be evaluated with a post-test and self-reflection and the resources from Birth Tools and the ACNM's Clinical Bulletin number 60. The third objective, perform correct procedure and technique of IA, will be covered briefly in the PowerPoint listing the procedure, and then in the simulation covering the maternal positions, Leopold's, uterine contractions, maternal pulse, Doppler placement, baseline fetal heart rate, counting fetal heart rate, frequency, interpreting, and documentation. This will be evaluated using a clinical performance checklist, and the resources were ACNM Clinical Bulletin number 60, ACOG Practice Bulletin number 106, A1's Fetal Heart Monitoring 5th edition. For evaluation, the educators will complete a clinical performance checklist as the learner completes the simulation. There are 10 categories where the learner will either meet or not meet their criteria. The learner must meet 8 out of 10 of the criteria, and these include the maternal positioning, Leopold's, uterine contractions, maternal pulse, Doppler placement, baseline, counting, frequency, interpreting, and documentation. A debriefing session will also follow the simulation. For the post-test, there will be 5 graded questions with a mixture of multiple choice and fill in the blank. The learner must correctly answer 4 out of 5 questions, and the questions can include list 3 contraindications for IA, including 1 maternal, 1 fetal, and 1 interpartum example. Select the appropriate patient for IA from the list of 3 patients, and list the 3 benefits of IA. There will also be 5 ungraded questions on the teaching method and strategy, where the learner will circle agree, neutral, or disagree. And these questions will include, I feel more comfortable and confident in performing IA, the PowerPoint lecture was easy to understand, and the simulation further enhanced my learning in this lesson. Additional resources for the learner will be the website birthtools.org, where there are resources and toolboxes on fetal assessment, physiologic birth, and promoting progress in labor. There will also be a handout with a quick reference guide on technique, frequency, and interpretation of IA. And these resources will be helpful for the nurse to refer to later when the nurse may think of a question or when there's an opportunity for the nurse to use IA with a patient. And here are my references. Thank you for listening.